Hello there. If your managers are not following policies and procedures and the agreed ways of working, you have to be smart as a carer, as a team leader, as a senior carer. How do I mean? In this video, I'll be telling you some of the smart moves you have to put in place to safeguard and cover your back. In the health and social care, some managers do not follow policies and procedure. They do not follow agreed ways of working, but instead they tell you to follow it while they are not abiding by the policies and procedure. This is how you know. When your managers are cutting corners, they are not doing the right thing they need to be doing. That is a clue to show to you that you need to cover your back. How do you cover your back? As a team leader, as a deputy manager, if you discover that your manager, your care manager, is not following the proper procedure, they are always cutting corners. They are always saying, oh, don't document that. Oh, let us have this conversation in person. Or other, telltale sign. It shows to you that your manager is not following the procedure. How do you cover your back? Because at the end of it all, the blame will go back to you. So for every conversation you have with your manager, if you notice that your manager is not following the policies, they are cutting corners, you will know at some point when your managers are not following the right procedure. They try to cover up, they try to do things without documenting. They try to, discuss with you without putting evidences down. That is a proof that your manager is not following the proper policy and procedure. In that case, you would need to document. So every conversation you have with your managers, because they want to have the conversation in person. Managers that cut corners, managers that do not follow procedures, managers that do not work with the agreed ways of working would always want to have a conversation. They don't want to go by the email, sending email to send something to you. No, they want to have a physical conversation with you so that you don't have anything to prove that so and so happened. How you know that the manager is not following procedure and policies is when you're supposed to do a particular task and they are asking you not to do it. That is okay. You need to cover your back. How do you cover your back? When you have a conversation with your managers, you will need to, after the conversation, you will need to sign. After signing, you will need to go back and send an email of the day, the time, and confirm everything that was discussed in the meeting. You confirm, you discuss, and you send it to them. That is a way of covering your back. In other cases, your managers ask you, for instance, you went to a resident and the hoist is, not serviced, and you reported it to your manager, and your manager or your team leader is saying, oh, don't worry, use it. You would need to confirm in a written documentation that you spoke to your manager, your team leader, and they ask you to go ahead. After you've covered your back, if it's still okay for you to maintain that the hoist has not been serviced, that it is due for service, and your manager, because some manager still insists that you use the hoist, because you also want to, because you also want to do your job, I will advise you, when they are insisting for you to use the hoist, after using the hoist, you will need to send an email. You will need to document the day, the time, the hoist name, the day the hoist was, due for service. You need to document all this just to cover your back, because I can assure you as a carer, If anything happens, your manager will use it against you. So for more tips, please comment in the comment section. If you have a manager, you know, that is fond of cutting corners, that does not go by the policy, I want you to comment on the comment section. Let us engage and support you as you navigate your job or your role as a carer. Until my next video, is bye for now.